All right, so 5 things to know about pregnancy in Egypt. I'm Dr. Fatou Forna. I'm an OBGYN who works to keep pregnant women safe in the US and around the world. And I travel a lot, and today I'm in beautiful Cairo, Egypt. So I wanted to come up here and talk a little bit about pregnancy in Egypt. Egypt actually has, the women in Egypt have 2.2 million babies a year. So they have a lot of babies. Kind of not too far from the US. The US has about 3.5 million babies every year. One of the things that really shocked me was they have a really, really high C-section rate. One of the highest C-section rates actually in the world, 72%. According to the Ministry of Health, 72% of all births were by C-section in 2021. Egypt is only one of 5 countries in the whole world where there are more C-sections than vaginal deliveries, which just blows your mind. And it only got to that number recently. In 1992, less than 5% of deliveries were by C-section in Egypt. So that's amazing. A lot of it is by maternal request, some from the doctors. So very alarming there. Just to put things in perspective, the US is around 30% or so. Number 2, Egypt has a lower maternal mortality than the US. 17 maternal deaths per 100,000 live births, where the US has 32. So Egypt, has done a lot of work to kind of decrease their maternal mortality recently. Number 3, universal health care. Egypt has universal health care, which they started in 2017. That's really a big deal. A lot of countries around the world are trying to make sure that everyone has access to affordable health insurance. So Egypt is doing a good job. There, of course, it takes a while. It's getting phased in. It's about 60% of coverage so far, but that's great. The US does not have universal health care. Number 4, I love this about Egypt, is there a paid maternity leave, which is awesome. Women in Egypt get about 3 months off paid after they've had their baby. They get 75% of their pay, and actually they can get up to 2 years of unpaid leave protected. So that's huge. They're actually even working to increase the amount of paid leave. The US, as we know, has 0 paid leave that's mandated by law. We do have 12 weeks, 3 months of on FMLA, which could be unpaid. And then number 5, disparities. I want to talk about disparities everywhere I go. There are disparities here in the U.S., socioeconomic disparities, especially in the rural Upper Egypt where the Nubians are. So we see that disparities for Black people everywhere. We do know they have double child mortality up there. We don't have information about maternal mortality, but I would imagine that's the same. So Black women, it's really, really important. I'm sharing this information because we need you to survive and thrive. So wherever I go around the world, I'm going to learn about these issues and try to share with you. Okay? All right. Bye, y'all. Beautiful Egypt. There, this is where I am. The wonderful pyramids. So I want to come up here and talk really briefly about pregnancy and maternity care in Egypt. Oh, I forgot to say, they don't have a lot of midwives. That's something they're working on, and I think that would help towards reducing that C-section rate. All right, talk to you all later. Bye.